Today I'm going to be taking a contrast study of my dog Norman. He's a male-neutered 2-year-old beagle mix. For this video, I actually used BIPs, which are barium impregnated polyethylene spheres, instead of doing an actual barium study with barium. BIPs are a little bit cleaner. They don't get all over the patient. It's easier to give them. Financially, they are pretty comparable. And you don't have risks like you do with barium. Barium you can actually aspirate or have the patient aspirate, but with BIPs you don't have that problem. So contrast studies can be used either a positive or a negative medium. Positive contrast agents appear white or radio-opaque, whereas negative contrast appear black and radiolucent. There's different types of positive contrast agents as well as negative. Positive, you have barium, you have different types of iodine, and you have the BIPs. With using a positive contrast medium, the KVP may have to be raised slightly. If you're using a negative contrast medium, the KVP may have to be lowered some. Dosaging for barium suspension is 8 to 10 milliliters per kg for dogs lighter than 10 kgs and cats, 5 to 8 milliliters per kg for medium-sized dogs 10 to 14 kgs, 3 to 5 milliliters per kg for dogs heavier than 40 kgs. When measuring, we measure at the thickest part of the liver, or thickest part meaning around the liver, or the TL junction. We're centering caudal to the 13th rib in the dog, or 2 to 3 finger breadths caudal to 13th rib in a cat, including cranially from T9 for VD views and T7 for lateral views, and caudally to the acetabulum. For the cranial abdomen, for gastrography, measure and center at the TL junction, include cranially from T9 for the VD views and T7 for the lateral views to L5 and L6. So Norman was given the BIPs around 9:45 in the morning, and the images were taken around 6 o'clock in the evening, and they made it to the pylorus. They do recommend taking the x-rays 6 to 24 hours afterwards, after giving the BIPs. I did actually radiograph him the next morning, which was about 24 hours afterwards, and they had moved all the way through to the colon. For barium suspension, you're going to take multiple different films. You're going to do it immediately, 15 minutes, 30 minutes, and 1 hour afterwards for cats and dogs. The end of the barium study is going to be when the barium or the BIPs get to the end of the colon. It's important to label your radiographs correctly with time after barium was given and the correct side of the patient. And typically a lateral and a VD view are taken. However, sometimes it's necessary to do a VD, DV, right lateral, and left lateral. It just depends on what study you're doing.